Hope is a very cheerful little girl, bubbling with daily energy, always active in class, playful on the playground, and very health conscious, brushing her teeth every day and eating healthy meals at all times. It's a bright sunny day, and cheerful and happy Hope is on her way to school with Grace.
Hey, Grace, double up. We need to get to school before the bell rings.
Here we go again. Always excited about school. What is it, Hope? You seem to be slowing down.
Yes, Grace. Suddenly I feel weak and tired.
Tired? But we have barely walked for long and have done nothing active to make us tired.
That's the strange thing I don't get. I had my breakfast, so I don't understand why I should feel weak.
I recall you had the same feeling yesterday on our way back from school. It may be a sign there is something wrong with you.
You may be right. I will go back and tell my parents right away. I don't think I can make it to school today.
That's okay, Hope. Your health is more important.
Hope's mom got a bit concerned. Without delay, she visited a local health facility for a quick checkup.
After examining her, I believe we are looking at a typical case of anemia.
Anemia makes you weak and tired?
Yes, it is a sign you have low blood level in your body. The symptoms is what she's experienced.
How is it treated?
Blood tonics. She will be fine after taking these medications.
Thank you, doctor.
Despite the medication, Hope grew more and more tired and fatigued. She suffered infections and the body bruised easily. She easily lost appetite for food, and alongside some bleeding gums, there was also cold and feverishness as the condition continued to deteriorate.
I can't take this anymore. I think we need to take her to another health facility for a second opinion. What do you think?
Totally agree. Something more than the anemia must be happening to our daughter.
At the teaching hospital, Hope met the pediatric oncologist who trained with a scholarship from Merck Foundation. Dr. Martin quickly identified new development in Hope's condition: swellings in the neck and abdomen, weight loss, red rashes on the skin.
I suspect something terribly wrong, but don't worry. Everything is going to be just fine. I'm going to run a few tests on you, just to be sure of what's troubling you. Then, we shall see how best to tackle it.
After the lab test was conducted, Dr. Martin finally had the results.
Well, it's not too good from what I suspected earlier. It turns out we are dealing with acute lymphoblastic leukemia.
Acute what?
It is a form of childhood cancer of the blood and bone marrow that affects the white blood cells in the body. It is not clear what causes the DNA error to lead to this leukemia, but there are certain factors that increases the risk: genetic disorders, exposure to radiations, previous cancer treatments. These signs, though may be mimicked by other diseases, are highly suggestive of cancer, hence require urgent attention. Persistent pain in the abdomen, obvious change in size of a wart or a mole, unexplained fever, unexplained tiredness or weight loss of 10% or more within 3 to 6 months, changes in bowel or bladder habits consistently for 2 to 3 months, nagging cough for more than 2 weeks, a sore that doesn't heal, indigestion and difficulty in swallowing, lump in the breast or elsewhere that has progressively enlarged with or without associated pain.
What's the next line of action?
Cancer treatment, which includes radiotherapy treatment, at least for the next 4 weeks. We need to be vigorous to arrest the situation.
With a heavy heart, Hope's parents had to embark on a journey to fight for their daughter's life. Fortunately, aside her parent, Hope had the support from her neighbors and friends at school as well. 4 weeks into radiotherapy, Hope's skin color returned and her energy increased.
It's so good to see the cheerful Hope break through the struggle. We are so glad to see you active again.
Does that mean I am well?
You are definitely on the road to recovery. We still have a lot to do to ensure that the cancer doesn't return.
Hope's condition gets better in an additional 3 months of treatment. Her positive attitude and will made a big difference in the recovery process.
Yay! I'm definitely sharing this good news with other patients. With early detection and a positive mindset, recovery is possible.
Hope's story became an inspiration for many in and out of the hospital. They became aware of the threat of cancer in childhood and how quickly to detect it for any treatment.